Paul Hutchison. Dr. Paul Hutchison.
It is with great pleasure that I speak on this very timely New Zealand Public Health and Disability Bill, but I must say it is with profound regret that I've had to listen to the Honourable Ruth Dyson give a speech that she probably gave in 1992, but has failed to move on to the reality of the legacy of the last Labour government, which basically left a health system bloated with bureaucracy, absolutely fragmented all over the place, and had the lowest productivity score that one could possibly imagine. I'll go on to that in just a minute. It is highly relevant that this bill is a response to many of the recommendations of the Ministerial Review Group, which was so ably led by Murray Horn. And in that review group, he pointed out the sustainability of our public health and disability system is under serious threat. And that, by no coincidence, is following the 9 long years of the last Labour government. The review group noted a variety of things: that New Zealanders want a public health and disability system of the same standard as other OECD countries, yet we do not earn like those countries, so our system needs to be more effective and productive than the OECD average to bridge the gap. And that is exactly why we have this bill today, and that is exactly why tomorrow the National Government will be introducing a budget committed to putting in a system that is on achieving economic growth, encouraging saving, exports and investing, rather than the rampant consumption and spending seen under the Labour government. The thing to achieve a sustainable health service is that, on the one hand, we do need sustainable economic growth, which we did not get under the Labour government, and secondly, we need an efficient and effective health system, something that was totally forgotten by Labour during the previous 9 years. The Ministerial Review Group also said the public health system still struggles to sustain itself financially despite the substantial increase in funding over recent years. DHBs are running deficits of about $150 million, this was in 2009, and have significant unfunded capital requests. It is absolutely rich of the Honourable Ruth Dyson to go back to the 90s, given the abysmal performance under Labour over the last 9 years. In fact, the Treasury Review report of 2005 showed that real hospital expenditure between 2001 and 2003 was 13.4% higher than at the beginning, which basically meant that hospital efficiency fell by 7.7% between 2000 and 2003. The previous 3 years, it had a modest increase in efficiency of about 1.1%. But this absolutely clearly outlines the problem of the Labour legacy, whereby hospital efficiency fell to 7.7% per year and consequently cost billions of dollars to the New Zealand taxpayer. We know that during that time, $6 billion extra dollars were put into the system, and we know that there was hardly any increase in elective surgery, and yet in the last year, under the national government, there have been an increase of 11,800 elective surgeries carried out. But to emphasise the point even further, it is relevant to look at the Auditor General's report on primary health care in 2008. This was going to be one of the flagships of the Labour government. And while I freely acknowledge that an extra billion in funding made access to primary care more affordable, the Auditor General points out the hopeless lack of tools that Labor put in to measure the result of its investment accurately. In fact, Labor brought in a radically new system but failed to ensure value for each health dollar spent. And Mr. Speaker, if Labor are to be critical of this bill's aims, which include to amend the objectives and functions of DHBs to ensure that DHBs work together for the most effective and efficient delivery of health services to meet national, regional and local needs, and to support the provision of shared services across the public health system, I would like to remind the Honourable Ruth Dyson of what Annette King said in August 2000 on the first reading of the New Zealand Public Health and Disability Bill. She said this: the DHBs will be expected to work together and to enter into cooperation and collaboration arrangements to ensure service delivery to their population. That failed to happen under 9 years. Annette King said that back in 2000, but she missed out the words efficient and effective. She missed out the words efficient and effective service delivery. That is precisely what Labor failed to achieve over the 9 years, and precisely what this bill is about: efficient and effective health service delivery to individual patients throughout New Zealand. But more than that, Mr. Speaker, this bill is about the national government's determination to develop new modules of care which see the patient rather than the institution at the centre of service delivery, and which emphasises clinical leadership. This bill is also highly appropriately creating a health quality and safety commission to improve on individual patient quality of care. I very much look forward to this bill progressing through the House to the Select Committee and coming back and being enacted in a timely manner.